My name's Noel Hayman. My background is Waka Waka and Kalkadoo. The biggest problem I found as I was doing medicine at the hospitals about access for Aboriginal people to care. You know, Aboriginal people had come into ED drunk, and I was expected to see them because I'm Aboriginal. So I thought, access to care is really, really crappy for Aboriginal people, not only in a hospital setting, but I found out later also in private general practice. Aboriginal people rarely access primary care. So I thought, what should I do about this? So at that time, our district was looking for a medical officer to look after Aboriginal and Torres Strait Islander health, and they asked me whether I'd do it. So I did. And one of the first things I did, of course, was met the elders here at Inala and just see what things we can do. Did a bit of mapping exercise about what services. And what came out dramatically was the least number of people that accessed the general practice in our community health centre, Inala Community Health Centre. So they have a general practice unit there that was called University General Practice when I first started. University because it was used for teaching medical students. And there was only 12 Aboriginal people that accessed that university general practice. So I just wanted to know why. So I did some focus groups and I got all these stories coming back. One lady said, I come in at 4:30 and said I wanted to see the doctor, and the person on reception said, well, why are you coming in now for? We close at 5. Go home and come back tomorrow. I mean, she wanted to see a doctor because she was unwell. And then I heard all these stories similar to that. And a lot of people brought up about, Aboriginal people pick up on body language, and they said, look, no, we just don't feel welcome coming to this centre. And I said, oh, okay. So, I took all that on board, and other patients said, look, we just don't identify with the place. There's nothing here Indigenous. There's no artwork. There's just nothing here that we identify with. So after doing those focus groups, I took on board what they said. So I paid for artwork done by local artists and put it through the centre. And that feedback about, people felt the staff were uncaring. So I did cultural awareness talks with our staff, and then also Nola, our nurse unit manager who's Aboriginal, she did some cultural awareness talks. So we tried to, broach that, that cultural divide, so to speak. And so just putting in that little intervention, okay, and the other thing was about no Aboriginal person, working there. And that's where NOLA comes in, because I actually got funding for NOLA, who's an Aboriginal nurse. First it could have been anyone, they wanted just an Aboriginal face. It could have been an admin person, it could have been someone working in in the staff or what, but they just want an Aboriginal face there. But I was lucky enough to get NOLA. So it's been the NOLA team now for 21 years, as she told you before. So it's been a real buzz working with NOLA and improving access for Aboriginal people. So in primary care now, we've gone from those 12 original Aboriginal patients to 10,000 on our data books now, and with probably about 6,000 regular patients. So we've actually improved access to primary care dramatically. And then I noted that our patients weren't turning up at hospital outpatients. So there was a problem accessing specialist care. So what I've done now in our new centre is to actually integrate specialist care in a primary health care setting. So for example, our patients wouldn't turn up to the hospital for their angiograms. They wouldn't turn up to cardiology outpatients. Now we have a cardiologist that comes here, does exercise stress tests and echoes here, and he comes every second week, and the appointments are full all the time. And he's here working back all the time because of the demand. Eyes, we found that our patients weren't turning up to outpatients to get laser, etc. So we have an ophthalmologist comes here now. He comes once a month, but sees about 30 patients in a whole day, very busy, and he does lasers and injections here. So again, improving access to specialist care. So we have an endocrinologist. He's here today actually. You would have seen Dr. Russell. So he's the director of endocrinology at the Princess Alexandra Hospital. So he comes here once a month and does a clinic. Other specialists we have is a gastroenterologist whose interest is in liver. Again, we found our patients weren't turning up at the hospital outpatients for Hep C treatment. So we actually do our Hep C treatment here in primary care. We've got paediatrician, we also have a registrar in paediatrics and also a registrar in rehabilitation medicine. So not only I see is important about access to care, but also teaching. I'm a big one for teaching, especially the new generation of doctors, you know, whether they be Aboriginal or Torres Strait Islander or, you know, mainstream doctors. I believe that it's important to actually pass Indigenous knowledge on for them to, you know, so they can care the best for their patient. So we're a strong one for teaching, so we teach registrars, we teach medical students, and we've had quite a few Aboriginal and Torres Strait Islander medical students come through our clinic too. We just had one finish up today. So, and because of that investment, we have a, you know, an education coordinator, and also I believe in research, so we have a research director here because to me we need to build the evidence base up in primary health care so we can actually, you know, do the best we can for our patients with evidence-based medicine. So, you know, research director, we have probably I think about 26 projects going on at the moment. And what I always try to do is, with this research, build up the evidence and then hopefully influence policy. So just recently, some of our research to do with taking photos of diabetic eyes at their annual diabetic check, we have been able to influence policy about MBS item number to be paid to do a retinal photo in primary care. So from the 1st of November, there's an MBS item number to take a retinal photo in primary care, which is great, and it, you know, so we can actually do the best for our patients.